Hello, my name is Clayton Jean, and I'm here to present to you my presentation on stress assessment and management techniques. Okay, so the first slide is about stress. Stress itself is a response mechanism responsible for mental, emotional, and physiological reactions. Stress itself is a normal aspect of everyday life. It is necessary for both motivation and achievement. These reactions are a result of situations that are new or may make one feel threatened, frightened, or excited. Stress levels are necessary for motivation and achievement of tasks and roles in work, social life, and relationships. A life without stress means one would lack the motivation to interact with the environment around him or her. Eustress versus de-stress. Eustress helps to improve performance and health, while de-stress is a harmful level of stress. As you can see, eustress itself is almost as if a motivational factor, while de-stress leads to negative impacts on performance. Eustress can be a great motivational factor, as previously said, that helps individuals meet expectations and become successful. While de-stress, as I previously stated, is a harmful level of stress that causes negative impacts on performance and health. Harmful stress levels can impact both mind and body. That's very important to know. Now that we are talking about mind and body, we're going to make that connection right here. Stress causes physical reactions within the body. Prolonged stress can cause physical diseases such as cancer, autoimmune disorders, diabetes, and coronary heart disease. Stress hormones cause physical reactions within the body. For example, adrenaline causes increased heart rate, which when prolonged for a long time can cause heart damage and insomnia. Mental health can significantly impact physical health. Psychological treatment for mental health are effective in reducing the risk for developing major physical diseases. Mental and physical health both impact each other, so treating the psychological symptoms help lessen the occurrence of physical symptoms. Now right here, you're going to have a graphic representation of the mind-body connection. As you can see, this is a cycle which starts with a belief system, which goes on to feelings and emotions, which goes on to touching to behaviors and actions, such and consequences and outside responses. So basically in the system, it's a cycle that goes on. So your belief system, you have beliefs that you can or can't do something. That leads on to emotions, like you're sad that you can't do such an. And then since you feel that way, you actually start to act that way, leading on to behaviors and actions. Such and such leads to consequences, like the repercussions that happens from that belief, and so on. It goes on to a cycle that just goes on to repeat itself, whether that be negative or positive thoughts. Stress vulnerability. Stressful life events can include social anonymity, parental conflicts, drug use, and alcohol use. Also included could be stigma, prejudice, and discrimination. Chronic stress from life events can cause an increased risk for developing mental health disorders. Those who experience significant mental health disorders are also known to have an increased risk of developing physical diseases. Of course, we all want to avoid physical diseases within our lifetime. Techniques for dealing with stress include coping strategies, which include self-help, approach, accommodation, avoidance, and self-punishment. There is also emotion focus, which is focusing on reducing the negative emotional responses, and problem focus, focusing on the causes of stress and aim to reduce or remove the causes. So obviously coping strategies, they're the coping strategies. Self-help can just try and heal yourself for as one of those examples. Emotion focus, you're basically focusing on the emotion itself and whether you're trying to combat that or not. Whether it's a positive, a negative, you're just focusing on that emotion to deal with everything. Problem focus, you're just focusing on the problem itself, what could be done about the problem, and just going head on about the situation. Some more techniques for dealing with stress include physical activities and adaptive activities. For physical activities, emotion-focused coping strategies are included. With physical activities, it also lessens the feelings of depression, anger, and anxiety. That's why it's important to exercise. You're not just working out your body, which most people think is the case. There are many studies about, just exercising, combating, or being used to combat depression or just other disorders. Adaptive activity gives an individual discipline and improves overall well-being. In conclusion, it is important to address the effects of stress on the mind and body. The healthiest stress response mechanisms are those that address the ways stress is perceived and problem solve the stressors. Here are my references. Thank you very much. This is Clayton Jean.